Hi, I am Ron Ackerman. I direct the Institute for Public Health and Medicine. Thank you all for joining today to our webinar series. I'm excited again to announce our second installment of what we're calling the Explorations of Careers in Public Health. Our facilitator today is Dr. Peter Orris, who's Chief of Occupational and Environmental Medicine at UI Health. He has more than 4 decades experience practicing internal and occupational and environmental medicine at Cook County Hospital and other institutions throughout Chicago. He's also a faculty member in the Department of Preventive Medicine at Northwestern University. Here at Northwestern, Dr. Orris has taught or co-directed several courses, including a popular course that brought local public health leaders to the classroom to talk about their own careers. And with Peter's help, IPHAM has brought that format to the IPHAM seminar series. Over the course of the year, we'll have a few sessions that are titled Explorations in Careers in Public Health. And today we're honored to have as our guest, Dr. Ngozi Ezike, who is joining us to talk about her career. Dr. Ezike is Acting Director of the Illinois Department of Public Health. She is a board-certified internist and pediatrician who comes to IDPH from the Cook County Department of Public Health, where she served for more than 15 years. She was medical director at Cook County Juvenile Temporary Detention Center, and prior to that, served as medical director for the Austin Health Center, where she actively engaged with community in a variety of health initiatives. It's my pleasure today to announce and turn the microphone over to Peter and to Dr. Ezike. Thank you both. Peter?
Thanks very much, Ron. And thank you, Dr. Ezike, for squeezing us in. And we really appreciate it. We thought we were doing pretty well when we heard the governor was once again quarantined. But on the other hand, it appears that he's getting a piece of your time this afternoon. So we really appreciate this. Let me, a couple of things for the participants. We would like you to use the QA notification at the bottom of your screen when you have questions, and we would welcome questions. I am only going to ask questions long enough to stimulate you to ask questions, but we would prefer today that you do not give us questions about the policies of IDPH, decisions recently made, or comments on any of the general policies related to Dr. Ezike's position as director of IDPH. Rather, today we are continuing this series in which hopefully we are presenting public health officials and activists for the value they have in their career and how they made decisions as potential role models for the students at Northwestern and others that are listening in. So that's what we're going to try to keep with today. But I don't mean to restrict you in any way, Dr. Ezike. If you want to broaden out, you want to take this and run with it, all yours. We're quite flexible on all of this. And you will see the QA questions as well on your screen, and you can dismiss some if you wish to do so. On the other hand, I need to repeat them because everybody doesn't see them. So I will read questions to you as they come up on the screen, don't answer the questions on the screen directly. So welcome. Thank you for coming.
Thank you.
Let me begin by just asking, since we talked and your introduction was perforce limited because of one can't give you an appropriate CV introduction without eating up our hour and our precious time. So we didn't do that. But where did you grow up? Are you a Midwesterner or what happened?
I'm not. I'm a Cali girl, an LA girl, born and raised in California. So I still don't really care for the cold, but this is my home, and my little people, like we go to LA, well, we used to go to LA, and they were like, yeah, this is nice, but yeah, I don't think I could do without my snow and my season. So yeah, this could never be a place for me. I'm like, did you really come from this womb?
So growing up in Los Angeles, you went to college in New England, as we generally say in Boston, euphemistically or generally. Anyway, and when did you decide you wanted to get into healthcare and wanted to be a physician?
Yeah, so I think it's part of, I am a daughter of immigrants, and I don't know, I think it's common in many cultures where one of the key aspirations is to have a child be a physician. I think that might be for many cultures, but definitely that was a big one for my dad. I think people who think that brainwashing doesn't work, it actually can. I think I grew up being told that I was going to be a physician, and I went through high school. I mean, it doesn't hurt when you're a strong student, very good student, then it kind of reinforces the dad's dream. I did go to college and loved a lot of things, and was thinking, oh, but law seems cool and business. And my father reminded me of the programming, and I stayed on course. But I always thought I want to do something to help people. Of course, that's what most people say that are interested in healthcare. And, I wanted to be able to make a difference, help people. I was able to go to med school. And then the issue was, well, I love every specialty. Like, I started off with psychiatry, and I was talking to veterans with substance abuse, and I was like, this is great. I'm connecting with people. I'm going to do this. And then the next one was, OB-GYN, and like every delivery was like the best day of my life. Oh, I want to deliver. So I went through that for everything. One point I was for sure that I was going to do urology. So it was just, I love all aspects of this. So then the choice then became, which one would allow me the most options? So I call it the choice of not making a choice to do both internal medicine and pediatrics, because it just kind of opened up, most fields and most areas, and definitely allowed me to take care of people from in the delivery room, with that newborn baby, all the way to the end of the spectrum, and haven't regretted that choice yet.
So you went through medical school back out in California, and you then went and got a business degree. Was that after you were already practicing back here in Chicago? And those of us with a public health degree want to know, how come you got a business degree and not an MPH?
Right. So I got it was a 1-year online business certification. And it was because I thought that maybe the next step would be, actually, what was it? I was going to, which role was I thinking about? There was a specific job that I had my eyes on. And so in preparing to, position myself for that, it was like, oh, you might want to show some, business chops. And so that's why, went back to get that Harvard certificate. But, no, so I don't have the esteemed MPH. And I think that when people work in the Cook County health system, when you're working with that population, I think, the public health and the health merges naturally, with the population health. You start to see how much, that's the purest examples of the fact that what I can do in the clinic, in the exam room, is limited, that there's so many things external to my interaction, to my medical knowledge, to my ability to connect with this patient that affect their health beyond, what I can touch. Saw that clearly with my Cook County patients, saw that clearly with the juvenile detention patients. Even their reasons for being there were based on reasons related to social determinants of health. So, a lot of the workarounds that you have to do even as a clinician or a clinician administrator when you get to actually affect some of the policies that take place, tied in directly to the fact that there are so many other factors that are playing into what we're seeing in front of us. And I remember saying so many times, like, if only this, you wouldn't even be in this situation. And so when some very, clever people said that, oh, your work in, creating universal screenings for detention kids for gonorrhea and chlamydia, and creating immunization programs and flu vaccination programs in the jails and in the communities on the west side of community. Looks like you've been practicing public health without a license, if you will. And so when the opportunity came to kind of take that kind of work on the macro scale, it was an exciting opportunity to pursue, and an even greater excitement to have actually gotten the nod.
Well, actually, I'm coming back to those questions as well later. But so you came then, you made a choice to come to practice in the public sector at some financial risk, and obviously the public sector pays lower than the private sector. This is a decision that not many of your colleagues made. Graduating from medical school. What propelled you to want to base your activities in the public sector as opposed to private and volunteer work and others?
Yeah, so I think being a minority, being from an immigrant, coming from more modest means, I think I obviously know a little bit better about the differences and the challenges of being in the have-not as opposed to the have category. And so I think, that kind of frames and informs who you are. And so you go forward thinking, oh, when I make it, I want to be the one that goes back to help people who look like me coming up, right? Who often, by virtue of their station in life, have less opportunities, less access, and so just wanted to be part of that solution, if you will, and know how much I always thought I was going to go back to a minority, underserved type of population, because Black women make up less than 2% of the medical workforce, and so being able to have other Black and brown people look and say, oh, I can be a doctor too. Like, that's another way to help feed the pipeline. And I really did see that on a consistent basis, where I'd walk in and they'll be like, you're the doctor? And so I think, at first you could be like, oh no, but yes, I am. And you can be too. And so as a pediatrician, being able to share, be that for some small kids in their formative years, I think there's some clear benefit to that.
So this question then takes you from that, or from that area that you're talking about, and applies it more generally in public health, for your opinion. I'm from Little Village and will be wrapping up my MPH in epidemiology this December. I find myself battling the imposter syndrome often. A little bit what you were referring to. What advice do you have for women of color applying for epidemiology fellowships and positions?
Well, first of all, congratulations on that wonderful field of study that you've embarked on. You are seeing firsthand how critical that field is, how important it is. It's center stage right now, so kudos for that. That imposter syndrome is real. I know I've read several books on the topic and have worked with some counselors to discuss this topic. And it's very common. It's very common in women. It's very common in minorities. So it's something that, I don't know if it's, society often, is not being, quote, the dominant culture, whether by ethnicity or gender. It plays into that, where you don't feel that you deserve that seat at the table. I would refer you to the UIC School of Public Health graduation speech, the commencement speech that I delivered, I guess it's last year, 2019, which also speaks to that. And so I just want to tell you that you deserve a seat at the table. Not only do you deserve a seat at the table, your voice needs to be heard. You bring a unique voice, a unique background, a unique perspective that can't be offered by the people that don't look like you. And so please be aggressive in a positive way in wanting to share that voice. There are so many discussions that I have sat in, and it's kind of frightening how many times I'm sitting at the table making hugely important decisions, and I'm literally the only woman and the only person of color at the table. That is still happening in discussions here in Illinois today. And so when I'm bringing up points, it's like, it's almost radical. It's like, oh, we didn't think about that. I will talk about there was a food outbreak. It was tainted carnitas in a restaurant, I think in Little Village. And, everyone was talking about, we have to do this, we have to do that, da, 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 da. And no one talked about translating, the press release into Spanish. And it was like, really? And so we have to have everyone seated at the table. We get a more robust answer. We get a more complete answer, better solutions when people who have different lived experience that bring different information to bear, bring it to the table. So I'm so glad you are where you are. I hope you never doubt yourself, but it's a fact of nature. But just be aware that it exists so that you can overcome it. You can squash it and say, I see that imposter syndrome coming up. And I say, get thee back, imposter syndrome, and I'm going to continue to move forward.
And making some assumptions about another questioner, you have books you would recommend for women in healthcare, women from minority communities?
No, I read several of the books on the imposter syndrome. I'm forgetting the authors of the two that I read. I like, oh, yes, what's her name? Why am I blanking? Stacey Adams. Stacey Adams, I think her book kind of speaks to that too, in terms of trying to find your voice, speaking up, being able to be the only voice, looking like how others, in the room don't look. I don't remember the name of her book, but I think she only has one. I'm not sure, but Stacey Abrams has a great book. Dare to Lead by, is it Brené Brown? Yeah, those are a couple that I think are kind of focused around this topic and help lead you in the right direction.
So let's take you back then. You came back to, you came to Chicago. You began to practice internal and occupational medicine, having been trained in occupational medicine. Never mind, that's the other Ezike.
The other Ezike.
Full disclosure, Dr. Ezike's husband and I are colleagues in occupational medicine. But in any case,
you're his mentor.
Okay, even better. So in pediatrics and internal medicine, you came for a clinical position, and then you began to direct the Austin clinic. Is that the progression there? And
right.
Why did you decide to take on some administrative aspects in the clinic? It would seem to be, especially within the county system, you'll pardon me, the frustrations of administration are such. Why did you move in that direction?
No, that's a great point. And I think that speaks to the importance of having mentors. I will say that, my first job out of residency was to join Cook County, and I was happy and very fulfilled as a staff physician. I had several clinic sites. I was in the south suburbs, in Fort Heights. I was at the Austin Health Center on the west side. I did, because I was able to speak Spanish, I could pinch hit at the Cicero Clinic. It was just a great existence. I was at Robbins Clinic. So it was great to be able to be in all these different clinics, see all ages. And so I wasn't looking for anything else. I was right in my sweet spot. We were coming up with all these innovative community programs. I was doing centering parenting, where I would have a dozen teen moms. Actually, it was centering parenting with centering pregnancy, where I combined with the OB provider, where as they were going through pregnancy, we're teaching them about how to keep themselves healthy during pregnancy, and already thinking about what are important things as being a mother and taking care of your baby. And so there were just so many great initiatives we had around diabetes and breastfeeding. So wasn't really looking for leadership. I was quite content, but my mentor, Dr. Hart, actually, Avery Hart, was like, yes, you're a great clinician. We hear great, the patients say great things, but, there's another step to this, and that involves being on the, decision-making side and trying to determine direction and policy. And I was like, no, I'm pretty good, but it's like, no, you should, you should try that as well. And so it was at his recommendation that I took my first leadership role as the medical director of the West Side Clinic at Austin, and really grow in a different way, And so I am grateful for that experience, because if I had never transitioned into physician administration, physician leadership, I definitely wouldn't be in the spot I am now. So it's very important, all that to say, it's very important to have mentors who really do support you, that believe in you, and that want to show you, additional paths, additional ways for you to really consider.
So getting a taste of administration and the difficulties therein, you decided you needed an increased challenge of complexity and you moved over then to the children's, the Audi home, as we used to call it, and this juvenile court, where you have the intersection of at least 3 significant bureaucracies: the county, the chief judge, I'm blocking. But anyway, why? And there's a bigger challenge. That one was in receivership at the time.
Exactly. So, okay, again, you can thank your mentors. So I was very happy at the Austin Health Center. And again, so now that I'm in charge, I get to do even more of this community connection and collaboration. We were partnering with the West Side Health Story, other community-based organizations, to just have more robust programming around, fighting obesity and diabetes. So I had again, when this was presented to me, I was like, first of all, I didn't know much. Most clinicians, I don't think, unless they had a specific rotation, you don't really know a lot about what they call correctional medicine, the practice of medicine within any kind of correctional facility, whether it's a jail or a prison or a detention center. So I didn't have any connection, and I was like, yeah, I don't think so. I don't think so. So that one was not an immediate like, oh, let's try it. I was like, I'm already in leadership, I'm good. But then again, this wonderful mentor was like, no, it's actually going to be quite a good challenge, a good stretching of yourself, if you will, because they are in federal receivership, and they were going to need all of their policies and procedures created to get out of receivership. And so you will be instrumental in, it was just this thing which sounded like that's going to be a whole lot of work, but it's yet new work. And of course, not knowing anything about corrections, that had that whole novelness to it. And so I bargained, actually. Yeah. And so never just say yes to anything. I'll put that out there. Like, you are worth as much as you say you are worth, right? So I remember saying like, no, I will only do it if I will get, I said, well, first of all, I don't know anything about correctional medicine. And so I did a little bit of research and saw that there was a correctional medicine conference in Florida that was just coming up. I was already going to be late registration. I was like, yeah, I don't know, because I don't know anything about correctional medicine, and I'm very comfortable where I am. And so I said, no, unless I am going to get, and I stated the raise that I had to get, and I thought it was outrageous. Like, I was just like, I'm going to say all these 3 things and I won't get it, and then I get to stay where I am. I want this much money. I want to have a personal assistant, because everything in county is like DIY, do it yourself, and you're one-man shows. And I want to go, I want this trip to this correctional conference, so that if I'm going to do this, I'm going to dive in at this 4-day conference and really get a handle on what it is to be working in a correctional facility. And so, I thought that was like, oh, she's really lost her mind. And then it was like, yes, yes, and yes. It's like, oh, and so there I went. And that has been just it was a ton of work. It is very hard to work in medicine in a correctional facility, because the correctional facility people say security and safety is all that it's about. Your medical stuff, yeah, like safety and security. And so anything you're trying to do, if it gets in the way, if you're trying to do something that isn't 100% aligned with their protocols, it was a struggle. And so the first couple of years were such a struggle, until people got to know me, where I was coming from, saw the good work I was trying to do, and then we just gelled to do such out of the box stuff, even in the detention center. I mean, we created the flu vaccine. They were not giving any shots in there. We started giving the flu shot right before Halloween. We tied it where we would give them some, because I was somebody who was trying to, I looked at the obesity rates in there. Kids that stayed there more than 90 days, their BMIs just grew. So when I was coming in telling them, okay, we got to get the soda out of here, I was affecting their kitchen. The kids were like complaining that, Dr. E keeps saying that, you guys have to stop feeding us this. So there was a lot that I did, a lot that I was empowered to do, that I would have never been able to stretch my wings that far. There wasn't that much stretching to be done in the clinic. And so it really was like another level of leadership and administration, and dealing with bureaucracy, and dealing with people from other segments, not just medical people, correctional people, judges, state's attorneys, lawyers. Like, it was really a great opportunity to work with so many facets, and really do some great things for a very vulnerable population. So no regrets. And again, everything that you do, and I'm putting this out there, no job that you do, no experience is wasted. It all just adds to your repertoire of lived experience and knowledge, which just gives you so much more in your arsenal for whatever the next step is. I keep thinking about that. I mean, even when I took a class in college, I like languages, and I took French in school as, in LA, but not useful. I'm still pretty fluent in French, but really don't get to use it. So I got to college, and along with physics, and, I was thinking about doing computer science. I said, I want to get back to languages. And I said, I'm going to take this intensive Spanish class. And my father, who was, kind of a helicopter parent, was just like, Spanish? What are we doing in Spanish? Like, you need to focus on pre-med, remember? Pre-med. And I was like, I don't know, but I think it's a nice way to balance out all these labs and all these problem sets. And so I'm sure he's looking down from heaven, just laughing hysterically that this Spanish, that he was like, what is the point of that? I was delivering press conferences with the governor in Spanish every day for like 3 months in a row. So, nothing is ever wasted. Who would have thought that, the correctional experience would be so key, as we were now dealing with a pandemic, that I understood how correctional facilities work, to talk about how you can sequester and isolate and quarantine people even within the confines of a correctional facility. Being able to talk with people at the Department of Corrections, saying, yes, I understand, I understand what it is with the security personnel, nothing is wasted. So even if you take turns, veers, and you think like, oh, that's not what I wanted to go, I just wanted to go in this straight line, those detours will never hurt you. And so maybe it will take a little bit longer to get to where you wanted to get, but with those detours, you've brought all this additional information that will make that arrival at that destination even better.
And one of the first questions that has been here for a while, it would have, well, let me throw this one in and I'll get back to the other. Are you allowed, or have you been able to segregate some time on a busy weekly schedule for any clinical work, either at the audio home or now with the state?
No, that's a great question. And so my plan was, I hadn't been in the actual Department of Public Health before. So it was definitely a very steep learning curve coming in. And I said, okay, I was thinking within 6 months. Then after that, I had already found a federally qualified health center that agreed that I would work for free there just a couple of hours a week. So I didn't even get to that until like October. I started, had made the plans, had gotten authorization from the governor's office that I'm just going to work a few hours a week at the Federal Qualified Health Center. They understood that, there may be some cancellation, so it'd have to be something pretty flexible in case something come up. We had come up with a plan that would work, that, would be a walk-in clinic where I would see walk-in patients, so it wouldn't be necessarily that I would disappoint my panel of patients that were waiting to see me if they came in. I don't think you can do primary care with that kind of intermittent, oops, I can't make it, blah, blah, blah. So I was really excited to do that. We were trying to get that together. And then, let's see, January, February, when we should have been like finalizing paperwork, that's when COVID hit, and we have not talked about clinic again. So no, I have not touched a patient myself really since I left. And so that's been 1.5 years. But I do think it is very important. I don't want to be that physician that's, out of date and doesn't really know what it looks like on the ground. And so I am hoping to get to that. This is obviously an even more challenging time than when I started, 18 months ago. So don't know exactly when, but I would like to get back to some, and I know a lot of public health officials do still find time to see patients. So I'm hoping to be one of those as well.
So let me ask just one last of mine, because we got a lot of them built up here. But so then the next stage in the career was you had now gotten a good deal of experience with both clinical and administrative work, but running institutions that you could make a change with and change policy and direction there, and effectively implement programs online. Then the governor calls, the new governor calls, and he says, come on and probably take another cut in pay and join me and advise me. And the principal role now, transitioning to the public health role of being primarily an advisor to the politicians, and dealing on policy level and recommendation for what other people will do. Why was that attractive? And has it been frustrating? And we're not asking you any particular questions about this particular governor, but what you get done is through the politicians, if you will. How do you do that?
Yeah, so I think the initial call wasn't from the governor. It was somebody from the transitional team that said, your name was elevated as a name that should be put on a short list, and would you want to be considered? And I had to really kind of do some research to think, what exactly does this mean? And how does it, intersect? Of course, it was a fantastic opportunity. By the time I was putting together the cover letter of why I absolutely should be on this short list, I saw how so many of the things that I had done intersected well and could just be taken to that larger scale, on that more macro scale. I think I could say that I couldn't have imagined, all of the challenges therein. Obviously, I did not see the pandemic coming around the corner, of course, but nor did I even see vaping, right? That was like one of the first things that I came in, and then we had this rash of the vaping vaping related illness. So it was a great opportunity to see if we could actually do the things that when you're in the clinic or when you're doing physician leadership, where you're saying, if only this was already in place for this child or this resident of the community, maybe we wouldn't get here. The fact that you could actually work with real money to work on real programs that could actually intersect with these people's lives to improve their health outcome was just like, wow, like that's obviously the place to go. That's obviously the place to go. So I didn't know if I would get it. When I did get the final call from the governor saying, you know, because the final interview was with the governor, and then you're waiting. It was such an exciting thought, and it really has been just an incredible roller coaster ride, but fun and challenging and edifying and satisfying all the way through.
So some of the rest of us knew it was a great and obvious choice, but that's another question.
Not everybody.
There's a question now toward the future that we have here, and that is, how do you see the involvement of quote unquote private health, or if you will, health insurance, health institutions that primarily are in the private sector or voluntary sector, participating in population health and public health as you've made this transition?
No, you can't have one without the other. They intersect. I know I have frequent calls with all the executives of hospitals throughout the state. You know, all the last week, I think, as recently as last week, you know, again, not to talk shop too much, but, you know, obviously we have regions of the state that are having more challenges with this infection, with this virus than others, where, you know, infection rates continue to increase and people continue to get infected at alarming rates. And so, you know, it was literally, I had to get on a phone call with the CEOs and COOs of the hospitals in that region to say, hey, partners, this is not just my problem, this is your problem too. Like, what are you going to do to help with this effort to get this really, you know, this situation here in your local area under control? And so, you know, it took me to make that call to have them, you know, say, yes, okay, we can do a combined, you know, we can do a combined social media campaign. We can work on this. We're going to be part of, you know, vaccinating against the flu. Like, we have to work seamlessly together. And so I think that is clear. Part of my job is to keep track of, you know, they have to report in all the individual hospitals, you know, the numbers of people that are admitted each day, the numbers of people that, you know, that die each day. We have to know from, you know, from the hospitals, how many people, you know, through vital records. We have the Office of Vital Statistics, which calculates all of these numbers. We have to know how many Illinoisans have exactly which type of cancer, which cancers, which age groups, you know. So we are working together on all of this. This private health to population health to public health. It's really all part of one big health picture.
Now, I have a number of questions here about how to get started in this area. And let me just summarize. Well, I'll ask each one quickly. We have a health lawyer on the line, and she wants to know, are there positions for lawyers in the public health sector, and what do they do? How do you get started there?
Great question. There is room for everybody in public health. I don't even think I knew fully how broad it was until I was in. And I know different states, the purview of the public health department might be different from state to state, but, you know, absolutely the legal team, the general counsel, and all of her team, they are a critical part of the department. first of all, there are all kinds of contracts that we're getting into with other entities, whether it's as part of giving them money to do the work that we want to have seen done. We want to make sure that the deliverables, you know, that we're expecting, you know, are in there. When we're dealing with, well, obviously we will get sued. I'm named on quite a few lawsuits. You know, when we're thinking about actions that we're going to take in terms of the Public Health Act gives us certain roles, certain abilities, and then trying to interpret whether, you know, this next thing that I want to embark on, is it within this act? Is it just a stretch of what's here, or is it going to be, will it not pass muster? You need someone with that legal background to be able to tell us, hey, you're going too far left, you can't go there, here's what you can do. So absolutely, I talked to the legal team. They're part of like everything that happens in the department. We also need statisticians, you know, of course, we need informatics people. Public health is short on the strength that it needs in terms of the informatics. And so, you know, computer science people, of course, the EPIs, what other fields? Environmental health, that's something that's just growing, that we need more people, you know, around that. Who am I forgetting that people don't obviously remember? If someone asks me if they're needed, the answer is yes.
So here's another career question. I'm very new to public health, and I've been feeling very unsettled with how minorities face discrimination when it comes to healthcare. Where do I recommend one? Where do you recommend one get a start with jobs related to epidemiology and public health that helps aid those underserved communities?
So I think a lot of community-based organizations would be excited to have someone with that background. I know we are working, it's very important to me that I build the pipeline. So I'm working with Central Management Services, which is kind of like the human resources for the state, to really try to build formal internships at the public health department, and not just internships where you get a great experience and then you still looking for a job, but internships that will help you to get a starting job at the department. We actually want to identify great people, train them, and then keep them. And so we're working on building that now. We do have internships at the public health department, some paid, some not paid, and we are working on building infrastructure so that we can build that pipeline and keep people. But outside of, you know, so we're at the state health department. Of course, there are local health departments. There's the Chicago Department of Health. There's, you know, the Evanston Department of Health, Skokie, I think Oak Park, you know, DuPage County. So there's a lot of local health departments that have opportunities for someone coming up, as well as many, you know, there's many organizations, community organizations that are focused on public health, you know, Public Health Institute, Illinois Public Health Association, like, so there's no shortage of public health, formal public health, and then other organizations, even, you know, philanthropic organizations that have an interest in doing public health work. They also would absolutely take on someone with that background. And of course, there is even, you know, pharma obviously has opportunities as well, and they are growing in their desire and push to work on how they can make sure that medicines that they're developing include minority people in the trials, and that they get the medicines that are available once they do hit the market. So there's a lot of different avenues.
So then there's a general question that says, how do you stay motivated despite seeing and facing difficult circumstances? And I would add to that, do you see coming from first generation immigrant Nigerian family being part of that, how does that interrelate?
To being able to stay positive?
Positive, facing the kind of frustrations
Yeah.
let alone the statistics with the current
Yeah.
COVID situation.
No, I think that some of that might be how I'm wired, that some of that might be from my culture, my faith culture, in terms of, whatever you're seeing now, and I can always see the silver lining, even if it's all cloudy, and also just appreciating that however difficult things might be, the point is that we're working, my team is working to make things brighter for tomorrow. So it's not in vain. I don't ever feel like the work we're doing is in vain. I think I can always extract, the progress that's been made, the advance that's been made, with the hope that they will continue to add up to make, tangible differences that improve the lives of the people of Illinois.
Next question. I am about to graduate with my MPH and also really excited to start a family with my husband, but wondering how to balance work and family life. Everyone's journey is different, but could you speak to your experience balancing your amazing career accomplishments with raising children?
Yeah, so if you're going to go into public health, say no to partners, say no to children, say no to extras. No, you absolutely, you can have it all. I think, whose book was that? I think that was Stacey Adams, where she was saying, where people want to say, oh, you can have it all. It's just, you can balance. You can't have it all, because it is a finite pie. You can't have it all at the same time. She likened it to a game of Jenga. I don't know if you know the game with the blocks, and you have a stack of blocks, and then the game is that you are pulling blocks out one at a time, taking turns, trying to find the block that you can pull out where the structure still stays stable and doesn't collapse. So I would say that, it is a challenge. It is a challenge. I know when I came into this role, everyone, I think the last time a woman had been in this role was like over 50 years ago. And I don't know if that woman had children or not, but the other people, nobody thought about, they would say, okay, director, you have to be in Springfield, actually Springfield is not even a problem. I can leave first thing in the morning and get to Springfield. You have to be in DC, by 10 a.m. So we'll have you leave out on a flight on Sunday afternoon so that you can get in plenty of time and relax and unwind and have dinner and da-da-da. And I would say, no, I'll take the 5 a.m. flight on Monday. It was like, oh, why would you do that? It's like, because that extra night with my family matters. Dinner on Sunday night with my family matters. And I remember we kept having to go through that reiteration. And she was like, I remember my assistant said, I haven't had to deal with someone thinking about their kids in this role in almost the whole time I've been here, because either people didn't have kids or they had wives that handled that. And so it's a paradigm that's changing because women are coming into these roles and are going to have kids. So yes, you can do it. I mean, it's incumbent upon women to set boundaries, because if you really want to be able to spend time with your kids, with your partner, to exercise, to do this and that, you have to be the master of your schedule. You have to be able to share your priorities with your team so that they understand. Sometimes I'll have to put the block where, I'm working, 80, 100 hours a week. So it's not, if I have to say, look, 12 to 3 next Thursday, I'm taking, all of my kids to the doctor for their school physicals. Like, that has to happen. And so if you could sit back and say, oh, I can't fit it in, and then have, the school send you delinquency letters saying your kids are not up to date with their shots, that makes no sense. So you have to be assertive, and you have to identify your priorities, share it with your team, and then, set some clear lines. You have to be able to create time for yourself. This job can take every single hour of the day, and I let it do that in the beginning. I think when it became clear that even if I worked 26 hours a day, that was not going to, change the virus being here the next day, then I realized, you can't keep skipping your exercise. you can't keep putting, you know, your kids or your partner to the side. And so now I think with time, I'm doing this better, but definitely, you know, I'm a former like collegiate athlete, Division I athlete. I played, you know, sports competitively still, you know, now, and I just let myself go. And so when people talk about COVID-19, I say, yeah, I put the COVID-19 right around my midsection, but now I'm trying to reverse that and get some of that off and make sure I show some of that balance or coordination to make sure that every part of me is being taken care of. If I take care of myself, I'll have more to give to the job.
So with deference to your necessity of being on time with the governor, we just really want to thank you, but I couldn't say it better than, and I want to apologize to all of the other questions that we're not going to get to during this hour. We'll do it again. I didn't even ask for permission, you see. We must do it again. But let me read to you this one particularly. Hi, Dr. Ezike. I used to be a pediatric resident at Cook County and now doing my pediatric nephrology fellowship at Lurie and also pursuing a part-time MPH. I just wanted to say it is so inspiring to see you today and hear about your journey. I also got a chance to work in juvie and it really shaped my viewpoint. So with that, I couldn't do better. Thank you so much for spending the time with us today.
Thank you for having me. It's a pleasure.
Okay.
Bye-bye.
Bye-bye.